I get a lot of questions as the College of Physiotherapists of Ontario's practice advisor, and it's my job to help people find the information they need to make informed decisions. The questions that come to me are about a range of things, but some of the more common issues are about supervising support personnel, scope of practice, conflict of interest, and boundary issues. I'll share a few examples with you. People ask me, how much supervision do I need to provide my assistant? Well, I tell them that there's no definitive answer, and as the physiotherapist, you need to use your professional judgment to determine what's reasonable in the practice setting you work in. Remember that the PT is ultimately accountable and responsible for assigning and supervising treatment. I often send people the Physiotherapists Working with Physiotherapist Support Personnel Standard and Guide. There's a lot of great information there that can be applied to a variety of situations. If you have other support personnel questions, you can always give me a call or send me an email. Another common question I get is about what treatments are considered to be within the scope of practice for physiotherapists. You might be surprised to hear, but the college does not actually have a list of treatments that physiotherapists can or cannot perform. A physiotherapist's scope of practice is defined in the Physiotherapy Act. The Act is posted on the college's website or available on the ELAW's website, and it's worth having a look at. I also remind PTs that they should have the knowledge, skills, and abilities to carry out a treatment. All of these factors need to be considered. High on the list of popular questions I get are those related to treating family members. Physiotherapists often contact me to find out if it's okay to treat a spouse, a child, or another family member. There's a bunch of things to think about. Things like conflict of interest, professional boundaries, and the availability of healthcare providers in the area. Treating a family member may not be the best option because there is a big difference between a personal and a professional relationship. In a case where there is no other choice, let's say you live in a small community, for example, if you determine that it is necessary to treat a family member, you should not bill for these services. You should also tell anyone receiving patient reports or recommendations about the care you provided and flag your relationship with the patient to make certain you are being as transparent as possible. I suggest people have a look at the standard and guide related to conflict of interest in therapeutic relationships and professional boundaries to make sure you have all of the information you need to move forward. Again, if ever in doubt, give me a call or send me an email and I would be happy to talk through the issues with you.